Hi, welcome to Jane Arrington's physical for class 612. Mr. Dawson has nicely agreed to be my patient today. He's emptied his bladder. He's in a proper attire for the physical. I've done his blood pressure, temperature, weight, and respirations. I did a height and weight on him. I also did a Snellen chart test on his vision and a Rosenbaum test on his vision representing cranial nerve 2. I just washed my hands and I'm ready to assess Mr. Dawson. We're going to start with his skin, and when I look at his skin I see that it's pink and intact and there's no edema or swelling noted to him. His hair is distributed evenly when I look over it, and his skin feels warm and his turgor is good. If we go on to his scalp, I notice that his head is monocephalous and it's without any deformities, and his scalp moves lightly, and his skin is intact. And again, Mr. Dawson, can I palpate your face? Okay, I'm going to start with his head. Tell me if there's any tenderness.
No.
No? Okay, there's no tenderness. I don't feel any bumps. And again, then I go to the forehead, and there's no any tenderness?
No.
No? And there's no bumps? I'm going down to the sinuses in the maxillary area. Do you feel any bumps? No? Okay. And then I'm going down to the TMJ area, the mandible area. And okay. And that is normal. Mr. Dawson denies any tenderness or bumps to that area. I'm now going to look at his face and his neuro. Mr. Dawson, can you, his face looks symmetrical, I notice when I'm looking at him. And then, can you raise your eyebrows? Okay. Can you close your eyes tightly? Okay. Can you smile? Can you frown? Can you grimace with your teeth? Good. Can you puff up your cheeks? And can you stick out your tongue? Okay, that's good. Everything is intact there. I'm now going to ask Mr. Dawson if you can close your eyes, but when I touch you, if you'll let me know if it feels sharp or soft. Okay.
Sharp, soft, sharp, soft.
Okay. So what we just demonstrated was cranial nerve 5, 7, and 12, and that they are intact with Mr. Dawson. I'm now going to look at Mr. Dawson's eyes. I'm going to start with looking at his eyebrows, and they look clean and intact, no lesions or swelling noted. They go down nicely down to the canvas. I'm then going to look at his eyelashes, and there's no ecchymosis or endomosis noted to that area. I noticed there's no dryness or redness with his eyes, and I'm now going to palpate your eyes, okay? I noticed that the lacular gland, there's no swelling or edema there. And I notice when I look at the sclera down here, it's nice and pink on both eyes. And then I also noticed that there's no jaundice or yellowing in his eyes, which is good also. And there's no redness or edema in his eyes. Okay, now we're going to look at your pupils. First I'm going to do shine. You'll feel a light shine on them, okay? You do the direct and indirect and direct and indirect. And his pupils are equal and reactive, and the size and shape is reactive to the light. Okay, if you could now, I'm now going to have you look over at the pen light. And if you could follow the pen light. Okay, and now over here. Okay, and that test was for accommodation. It shows that his eyes constrict nicely. And I'm now going to do the cover and uncover test. If you could place this over your one eye. Okay. Now if you could slowly remove it. All right. And now over the other eye. Okay, that's good. And the cover uncover test showed that there was no strabismus, so that was good. All right, the last test we're going to do for the eye, if you could just look at my finger. Now you're going to tell me if you see double at any time. Okay. And up.
No double.
No double, okay. All right, so we just covered with his eye exam, we covered cranial nerve 3, 4, and 6. Okay, I'm gonna look at Mr. Dawson's eyes. On the eye exam, I start with getting the scope down to 0 with my index finger. Okay, the light. And then I'm gonna stand right in front of Mr. Dawson, right to the side here. I'm gonna be left eye to left eye first. I'm gonna hold up his eyebrow. I'm gonna start about 15 inches away, and I'm going to come in, and as I come in with my index finger, I'm going to wind up, and I see the red light, and now I'm zooming in, I see the blood vessels. There's no crisscrossing, it looks clean. Then as I get closer, I can see the pulsations, the venous pulsations, and I also see the optic disc, which is formed, well-rounded, intact, with the blood vessels coming off the side. If he was dilated, I could look at the macular to see that too, but he's not dilated. And then I come out. I'm now going to look at the other eye the same way. I go right eye to right eye. I go down to 0, and then I hold. And as I zoom in, I'm going to wind up again. As I get closer, I see the vessels, and then I get even closer, I can see the optic nerve, I can see the pulsation. I see a normal eye with blood vessels coming out, well defined. And again, he's not dilated, so I can't see any macula. Okay, I'm going to look at Mr. Dawson's ears now. Mr. Dawson, let's see. His ears are lined up nicely with his eyes, which shows they're not dropped. There's no issues there. Okay, I'm going to look at your ears and inspect them. There's no lesions or redness noted. Can I look around one? Good. When I do the tug test and pull on his auricle, is there any pain?
No.
No? Okay. Same thing on this ear. Any pain? Okay. All right. Do you have any difficulty hearing?
No.
Okay, I'm going to whisper some words to you, and if you'll repeat them. A, C, D.
A, C, D.
E, F, K.
B, F, K.
Okay. No trouble there. Air conduction is better than his bone conduction usually. We're going to check that out. So now I'm going to do this. Tell me when this noise stops. Okay. 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 So I just showed that cranial nerve 8, we just showed that cranial nerve 8 is intact. His vestibulocochlear nerve is intact with Mr. Dawson. I'm now going to look into his ears. Okay. I'm going to pull up and out and look in, and the canal looks nice and pink. I see there's no excessive cerumen, and I see the tympanic membrane is grayish in color. I see the landmarks all visibly, and I see no enlarged membrane. And I'm going to do the same on the other ear. And again, I see the same things. It's nice and pink. Whoops, nice and pink. And I see that, everything's the same on this ear. Okay, I'm going to assess Mr. Dawson's nose. Mr. Dawson's nose is symmetrical and even. I see no lesions or sores. There's no dark areas under his eyes. Mr. Dawson, do you have any trouble breathing?
No.
Can you put one hand on your nostril and breathe in on the other? Good. Any trouble?
No.
Okay, and then the other? Breathe in. Good. All right. Mr. Dawson's nasal area is patent and there's no difficulty there. Now, can you smell this? Can you tell me what that is?
Close.
Cloves? Okay, the smell test represents cranial nerve 1. Okay, I'm going to look at Mr. Dawson's mouth. Mr. Dawson, can you open your mouth? Okay. All right, I'm looking at Mr. Dawson's Stenson glands, and it looks white and clean and no inflammation. And then his Wharton is also uninflamed, and it's on each frenulum. Okay. Can I look at your teeth and gums?
Mm-hmm.
Okay. All right. Open your mouth a little bit more. His teeth are all intact. His gums look nice and pink. His tongue has no sores or lesions on it. Okay, now can you put your tongue to the top of your mouth? Good. Now to the side. All right, no sores and lesions. And now to the other side. Good. And now to the bottom. All right, that looks good. All right. Now can you stick your tongue out? All right, can you say ah? Good. His ulna raised nicely, his pharynx is intact, and his tonsils are not enlarged. That just covered a normal study of cranial nerves 9, 10, and 12. Okay, I'm going to look at Mr. Dawson's neck. Mr. Dawson, can you put your hands out? Can you push down? Can you push up? Okay. Now can you push down on my hands? Good. Okay, can you push against my hand? Good. And then the other way? Good. All right, now can you shrug your shoulders? Good. That shows that Mr. Dawson's muscular is equal and intact with his neck. I'm now going to look at his neckline. Let's start by inspection. I look at his neck and I see no jugular distension. The skin is clean and intact. I see no scars or lesions on his neck. All right, now next I'm going to palpate. I'm going to start with the lymph nodes. I'm going to go with the preauricular, which is in front of the ear. I'm going to use my 3 fingers. I'm going to palpate around to the postauricular behind the ear, and then to the occipital, which is the back of the head. I'm going to go down the side to the tonsils, and then I'm going to go to the submandibular along the mandible here, and then I'm going to go to the submental, which is under the chin. I'm then going to do the post-cervical nodes, which is coming down in front of the ear, going down into the neck there. And then I'm going to go to that's the anterior, and then I'm going to go to the post, which is behind the post-cervical nodes. Then I'm going to do the deep cervical chain, which is right in the middle, in the back of the neck there. And then I'm going to do the same thing on the other side. I'm going to go in front, coming back to the occipital, coming down into the tonsillar, and coming up under the chin to the submandible, doing down the chains, coming down, down this anterior, and the chains, and then the back. Okay, then I'm going to do the supraclavicle node on either side, coming down between the head and the neck area. Okay, did you feel any?
No pain.
No pain? Okay, no tenderness? Okay, and I felt no lymph, so that's a normal finding. I'm now going to look at his epitrochlear. It's about 3 inches up from on the inside of his elbow, palpating up into his axillary, under the arms, and then I would go into there. Okay, any tenderness? No? Okay. And I felt no nodules. Again, I start 3 inches up. I go up into the axillary. I'm going to feel it up under the arm. And I feel no nodes, no distended nodes. And do you have any pain? Okay, so that's the end of that. I'm now going to listen to his carotids. I want to palpate first. I feel a 2+, and I palpate on either side. And then I'm going to feel his trachea in its midline. There's no tugging on it. And then I'm going to feel on either side, I'm going to feel his thyroids. Can you swallow? Okay. And there's no lifting of the isthmus. Now on the other side. Okay, good. Now I'm going to listen. I'm going to listen first to his carotids using the bell, one side at a time. And there's no No bruise heard. That's good. And then I'm going to listen again on the other side. No bruise heard. And then I'm going to listen down with the thyroid. And again, I'm listening for bruise. And again. No bruise heard. So Mr. Dawson has normal findings. I found no enlargement, no tenderness. We looked at cranial nerve 11 on this assessment. I'm going to be assessing Mr. Dawson for range of motion and the extremities of his arms and nail beds. Okay, Mr. Dawson, can you do some range of motion for me?
Certainly.
Okay, can you put your chin to your neck? Okay, can you turn your head right and then turn your head left? Okay, and then can you put your ear to your shoulder? Okay, and then your ear to your other shoulder? Good. Did you have any pain when you did that?
No.
No? Okay, that's good. Okay, can you put your hands above your head? Any pain, and then hands down. Any pain with any of those motions? No. Okay, that's good. That's a normal finding, the fact he had no pain with any of those motions. Okay, now I'm going to examine your arms. And his skin is intact. There's no bruises, there's no swelling, there's no abrasions or any sores on his hands and his arms. Okay, and the same here. All right. I'm going to look at your nail beds. When I look at his nail beds, they're pink, which is a normal finding. There's no ridges or extra nail. It's nice and it's all a normal finding. I'm going to press the capillary beds, and it's less than 3 seconds, which is again a normal finding. And can you feel all of that?
Mm-hmm.
Okay,
yes.
That's also a normal finding. And then again, I'm going to look at this one too, the same thing. They're pink, the nail beds are good, the nails aren't thick, and I'm going to again pinch. And he has a 3+, less than 3+ capillary refill, which is a normal finding. And I'm also going to look at his radial artery and the radial. To find that, I go right up the first finger there, right at his wrist, and I can feel that strong, and that's a normal finding. And then I'm going to look at his brachial, which is I go right up the little finger to his arm, to where his arm bends, and I can feel the pulse strong, and that's a normal finding. I'm going to do the same thing to the other arm. First I'm going to find the radial, that's a normal finding, and then I'm going to go up and find the brachial, and that's a normal finding. Okay, I'm going to start looking at Mr. Dawson's lungs. I'm going to look from the posterior and anterior view. If we look at him posteriorly, we see that he's symmetrical. We see there's no distress. His skin is clean and intact. When I look at his cervical area, I see there's concavity. I see his lumbar area has concavity, and I see his thoracic is convex. If we palpate down, I'm going to start by palpating down. I want you to let me know if you have any pain down your back when I'm doing this. Down his lumbar.
No pain.
No pain. And that's a normal finding, the fact he has no pain. Any pain?
No pain.
No pain. Okay, now I'm going to have you say 99 when I touch your back.
99, 99, 99, 99, 99.
Okay, so his tactile formatus is normal bilaterally, and that's a normal finding. Now I'm going to percuss between your interstitial spaces. And again, the resonance sound is normal, and that's a normal finding. Okay? Now, I want you to take a deep breath, and I'm going to wash, okay, and exhale. And you see the way he came in and then went out, that's his respiratory excursion, and that was normal bilaterally on both sides. Okay, now I'm going to have you take a deep breath, and I'm going to palpate down. Deep breath. Okay, and hold. Okay, I'm going to mark it. Okay, now on the other side. Hold. And when the resonance sound stops, I mark it. Okay, on both sides. Now I'm looking at his diaphragmatic excursion, and now I'm going to have you take a deep breath and exhale. Okay, and hold. And I'm marking it. Again, deep breath and hold. Okay, as long as they're between less than 3 centimeters, between the 2 marks, you have normal findings, and as long as they're equal bilaterally, and he is, so that's normal findings. I'm now going to look at his CVA, and I'm going to put my hand over his kidney, and I'm going to tap on it and ask him if he has any pain. Any pain?
No pain.
Any pain?
No pain.
Okay, so that's a normal finding. I'm now going to listen to his lungs. Can you take a deep breath in when the stethoscope comes on you? And exhale, good. And inhale, and exhale, and inhale, exhale, good. Inhale, and exhale, and inhale, exhale, and inhale. Okay, his visceral sounds were normal, and that's a normal finding. I'm now going to have him say 99 when I listen. Okay, again, we're going to do the same thing, but this time say 99.
99. 99. 99. 99. 99. 99.
That's good. The sounds were muffled, and that's a normal finding. If you can now turn around, Mr. Dawson, I'd like to look at your anterior chest. Okay, when I first look at his chest, I look for any trouble breathing. I see that there's no vein distension. He's breathing regularly, so that's a normal finding. I then look over his skin. I see there's no scars, lesions. His skin looks intact. There's no moles I need to look at or anything. Everything looks good and intact. Okay, I'm now gonna use my hands and put him over and have him take a deep breath. And good, see how even that is? Could do one more time. And even, so I see he's bilaterally even, and that's a normal finding. I'm now going to palpate and feel for any masses, or any pain or tenderness. So just let me know if you have pain or tenderness. Okay. And I don't feel any lesions, and any pain or tenderness?
No.
Okay, all right. I'm now going to put my hands on it, and I'm going to ask you to say 99.
99. 99. 99. 99.
And his tactile phonetis is equal bilaterally, and that's a normal finding. I'm now going to percuss. And the resonance is normal, and that's again a normal finding. Okay, and now I'm going to listen to his sounds, his lung sounds. Deep breath. Okay. Okay, I'm going to look at Mr. Dawson's heart. I'm going to start by looking at his heart sounds. I'm going to go to the second intercostal space, called the aortic valve, and I'm going to start, and it's on the right side, right here, and I'm going to listen to that. I'm listening for murmurs. I'm listening for bruits. I'm listening to the sound itself, which is a lub-dub type sound, S1, S2. Then I go over to the left side. Again, I'm in the second intercostal space. And then that is the pulmonic. And then I go down to the third one, and that's the ebbs. And I listen there. And then I go to the tricuspid, which is the fourth, which is right over there by the nipple line. And then I go right below the nipple is the bottom of the heart, the apex. And that is called the mitral valve. That's your strongest point there. The last three sites, I can use the bell of my stethoscope to get lower pitch sounds. And again, so I can better hear for those murmurs or bruits. And then up below. Okay, and Mr. Dawson has a normal S1, S2. Can you lay down, Mr. Dawson? And I always want to be on his right side. When he lies down, I'm going to start by palpating. I'm going to start over my apical side. What I'm palpating for is I'm looking for lifts, heaves, that kind of thing. It feels like a cat purring. And then I'm going to go over to the other side and do the same thing and come down and feel for that. Down into the mitral area. When I get to the mitral area, I'm going to go up and feel the carotid along with the mitral. And again, I'm feeling to see how the S1, S2 is, the impact. They should be equal. And I feel his in there. The sounds, the S1, S2 are both present. Okay. Now I'm going to go and listen to the sounds to the heart again while he's lying down, starting with the apical. And then I'm going to go across on the second intercostal space, down to the third, which is the EBS, to the tricuspid, over right by the nipple, and then I'm over there. And again, I'm listening for bruits and murmurs. I hear normal heart sounds. And when I reach the apical, I now want to have Mr. Dawson roll over on his side. And I'm right under the apical listening. And I again hear a normal S1, S2. Okay, I'm going to assess Mr. Dawson's abdomen. First, I'm going to look at the abdomen. I'm going to look for any abnormal pulses, and I don't see any. I then look at his skin, and I look for any scars, any lesions, any rashes, and I don't see any of that. He has normal findings in that area. I see his umbilicus, his midline, and so that's good. Okay, now I'm going to listen to all four quadrants. Oh, I wanted to do one more thing first. I'm going to push your head up, and I'm going to look, and there's no hernia that is apparent to him when I push his neck up, and that's a normal finding. I'm now going to listen to the four quadrants. I'm listening for vowel sounds. I'll hear like a rumbling, and I want that in all four quadrants. Here's the vowel tone. Heard that? And vowel sounds were present in all four quadrants, and that's a normal finding. Okay, now I'm going to listen to his aortic, right over here. And I'm listening for bruits. I'm going to use the bell. And then I'm going to listen for the renal. And then I'm going to listen for the iliac. And if I could get lower, I'd listen for the femoral. Get a little lower. And Mr. Dawson's sounds are normal. I hear no bruits, and so that's a normal finding. Okay, I'm now going to percuss his abdomen, and I'm going to look. I want to hear resonance. That's a normal finding. And I hear a nice sound. And that's. And I hear a normal resonant sound, which is a normal finding. I'm now going to palpate for his liver, and his liver can be found It's underneath the right side of the ribs, and it's also usually on most people comes down below the rib. So I'm going to find out how far his comes down to see if there's any enlargement. So I'm going to start by percussing, and I hear dullness in midline. And I'm going to mark that. And now I'm going to percuss again, this time from dullness to residence. I'm going to mark that. And again, Mr. Dawson is about 6 centimeters, and that's normal findings. Okay, now on the left side where the spleen is, I'm going to percuss there. And the spleen is usually all under the ribs for normal findings. So you won't find any dullness after you hit that 12th rib, and that's a normal finding, and Mr. Dawson has that. I'm now going to palpate Mr. Dawson. First I'm going to palpate the liver. And when I palpate, let me do the 4 quadrants first. I'm going to just palpate gently. Any tenderness?
No.
Okay. Any tenderness?
No.
Okay, any tenderness?
No.
Okay, when I palpate over here on the left side, I might look at the bowel. And if I had any tenderness, I might think of bowel areas.
No.
And then further over, I have the kidneys. And then on this right side, I might think of an appendix. And then I can palpate much deeper after that. And again, along the last rib here, where your liver comes out, if you want to palpate, can you take a deep breath? And I'm going to palpate inward, and I can feel that firm, non-tender area, and that's the liver. And exhale. Okay, then the same way on the other side, I'm going to look for spleen enlargement. And again, I palpate over there. And I don't find anything below that last rib, so that's a normal finding. I can also palpate another way by doing a hook method, where I hook the fingers under, and then I use the other finger to palpate, and that's a good way to kind of lift the rib on either side. You can do it that way also. Okay, I also am going to palpate now. I'm going to palpate the kidneys, and by doing that, the kidneys are on either side. I'm going to put my hand on this side, and then I'm going to feel, take a deep breath. I'm going to feel in. The right kidney is sometimes easier to feel. Again, breathe in. Sometimes easier to feel. Again, there's a normal finding. He has no pain on pressure on that. So that's a normal finding. If he were undressed, I would be able to palpate the femorals, and those would be a 2+ would be a normal finding. And also, I would be able to feel for the inguinals down there, the lymph down there, and I would feel for masses or, nodules or tenderness, and that would not be a normal finding. What you want to feel is just kind of a regular feel, none of those masses or tenderness. And that ends. Oh, I want to look at the aorta too. So let's look at the aorta. I want to feel for that. It's slightly over on the other side. I'm going to put my hand kind of off midline with my thumb in right above the umbilicus. And I can feel the blood flow. You can feel the direction of it by doing that. And that's how you palpate the aorta. Okay, I'm going to look at Mr. Dawson's legs now. I'm going to start by just looking them over. Okay, Mr. Dawson. So I just basically look over. Do I see any lesions, any skin breakdowns, any bones, anything that's out of the norm is what I'm looking for here. And his legs look good. They look equal distance. They're straight. That's what I'm noticing. Then I'm going to start palpating. I feel for any edema. I feel the skin is warm and intact. And I don't feel any edema, and that would be a normal finding. There's no edema around the ankles and no edema around the legs. They all feel warm and intact, and that's normal findings on the legs. I then start looking at the feet, and also, and I notice, can you feel this?
Mm-hmm.
You can feel me touch his toes. I look over, there's no sores to the bottom of his feet or his heels, and that's a normal finding. All the skin is intact, there's no calluses or anything. And then I look at his knees, I palpate around there, any soreness or tenderness?
Mm-hmm.
And I'm going to palpate around all the bony areas. Any soreness or tenderness? No? Okay. Go up, and the same thing on the other leg. Any soreness or tenderness?
Yeah.
No? Okay. Now I'm going to feel for his pulses. First the popliteal, which is behind the knee. And I feel strong. 2+, good. And then behind the other knee. That's intact. I feel at the top here of the foot, and this pulse is strong. And then again, I come in the inside, right in the little gouge right here, and I feel for that. And that pulse is strong and intact, and that's a normal finding. Same thing on the other side. And then again up at the top. Okay, now I'm going to check for muscle strength. Can you push up with your knees? That one, and then the other one. Good, and he has normal strength in both knees, and that's a normal finding. Okay, I'm going to look at Mr. Dawson's reflexes. I'm going to look at Mr. Dawson's reflexes. I'm going to start with the wrist, the brachial. I'm going to hit right there, and okay, you'll see it. And then the other one, and I hold him gently, and he's relaxed. Okay, now we're going to do the knee. Okay, can you come forward a little bit? And maybe come up on the sofa a little bit on the end, that'd be good. Okay, and then just put your knee over. That's good, all right. And I'm going to support him. And then I'm going to hold the bottom of the foot, and I'm going to hit the Achilles. All right, and then let's do the other one. Okay, and then we'll do the Achilles. Okay, and this was normal findings. Mr. Dawson had good tendon reflex. Okay, Mr. Dawson is alert. We're going to do his neuro exam. Mr. Dawson is alert to person, place, and time. I know from working with him today and from the questions I've asked him. Mr. Dawson, can you start by putting both hands out and having each finger touch your thumb, the opposite thumb? Good. All right, that's good. Now can you put your hands out and then turn them upside down? Any pain?
No.
No? Okay, that's normal finding. Can you bend down and touch your toes? Okay, and I'm going to look at his back. I'm going to look at his hips. Okay, that's all normal findings, the way they're equal and intact. Can you bend to the side, the right, and then the left? Okay, and can you bend forward? And then can you bend back? Okay, can you lift your right leg up? And then can you lift it to the side? Okay, and the other two, another one up and to the side. Good. Okay, now can you stand on one leg with your eyes closed? And good. And that's a negative Romberg's as long as you stand on one leg with your eyes closed and there's no swaying. And that's the end of our exam. You did a great job, Mr. Dawson. Thank you.